Hello students, I am Dr. Nazif Mahbub, the lecturer of the Anatomy Department at Dr. Sirajul Medical College. Today we are going to study on the topic of the nose and paranasal sinuses. This topic is the item number 9 of your head and neck card. So without further ado, let's begin. Okay, so what is the nose? Right, nose is an organ and it consists of the external nose and the nasal cavity. Right, so what is the external nose? Right, external nose is actually a pyramidal projection of the shape. If you can see, it's a pyramidal projection of the face and it presents a free tip, an apex and the root of the nose. Now each nose, you can see there are two nostrils in the nose, and the nostril is bounded medially by the mobile part of the nasal septum and laterally by the ala of the nose. Okay, now if you want to discuss the framework of the nose, we can divide it into bone and cartilage. Now the upper part of the bone, in the upper part, what bones are situated? The bones are called the nasal process of the maxilla, the frontal process of the maxilla, the nasal notch of the frontal bone. And in the lower part, there are some cartilages. If you want to be specific, the cartilages are actually the septal cartilage, the anterior border of the septal cartilage, then the nasal cartilage, the upper lateral border, the nasal cartilage, and also the alar cartilage. Now, this alar cartilage can also be called the lower lateral nasal cartilage. And apart from this, there are some few minor alar cartilage and some fibrofatty tissue. Now let us see the external nose's artery supply. So the external nose is mainly supplied by three arteries. They are ophthalmic artery, maxillary artery and facial artery. If we want to be specific, then we can tell that the dorsal nasal branch of the ophthalmic artery, the infraorbital branch of the maxillary artery and the alar and septal branches of the facial artery. In the nerve supply, we can know that the sensory nerve supplies are derived from both the ophthalmic nerve and the maxillary nerve. Okay, so if you want to know the branches, in the ophthalmic nerve, it is the external nasal and inferior conchal branches of the ophthalmic nerve. And for the maxillary nerve, the branches are infraorbital branch. Now, let's come to the nasal cavity. So the nasal cavity is divided into two halves by what? By a medial nasal septum. Okay. So the nasal cavity actually extends from the anterior nare, that is called the nostril. Okay. And to the concha. So from the nostril to the concha. Here nostril is the anterior nare and the concha is the posterior apparatus. Okay, so each nostril is cartilaginous and it is bounded medially by the mobile part of the septal cartilage and laterally by the ala. Now one thing you have to remember, that the area in the nasal cavity which is close to the anterior nare, that is the nostril, that area is called the vestibule. The vestibule is lined by the skin and it provides coarse hair. Okay, and apart from that, it also provides sebaceous gland and sweat glands. So the rest of the space in the nasal cavity, this is lined by the mucous membrane. Now let's come to the boundary of the nasal cavity. The nasal cavity is bounded by a roof, floor, a medial wall and lateral wall. Now what is the roof? Right. So the roof consists of three parts. They are the anterior, intermediate and the posterior part. The anterior part is also called the frontonasal part. Okay, so this part actually slopes downwards and forwards and this is supported by the nasal cartilages, also by the nasal bones and the frontal bone. The second part is the intermediate part or ethmoidal part. This part is actually formed by the cribriform plate of the ethmoid bone. And the last part is the posterior part or the sphenoidal part. This part is formed by the anterior and inferior surface of the body of the sphenoid. If you see the floor of the nasal cavity, we can see that it is concave from side to side, and this is formed by the upper surface of the hard palate. Now let's study the medial wall or the nasal septum. The nasal septum it actually makes the nasal cavity in two half. So the most of the septum, you have to know that it is lined on the each side by the mucous membrane. Okay, so most of the part of the septum is lined by the mucous membrane, but except for the movable part, or it is also known as the mobile part. That part is lined by the skin. Now if we see the bones of the medial wall, we can see that there are two major bones. They are the perpendicular plate of the ethmoid bone. This perpendicular plate forms the anterior superior part of the nasal septum, and the second bone is the vomer. The vomer forms the posterior inferior part of the nasal septum. Apart from this, there are also some other bones. They are known as the accessory bones. In the above and in front, the nasal spine of the frontal bone, okay, and in the above and behind, there is the sphenoidal crest of the rostrum, and in the below part, there is the palatine process of the maxilla. Okay, now let's study the medial wall or the nasal septum. The nasal septum, it actually makes the nasal cavity in two half. So the most of the septum, you have to know that it is lined on the each side by the mucous membrane. Okay, so most of the part of the septum is lined by the mucous membrane, but except for the movable part, or it is also known as the mobile part. That part is lined by the skin. Now if we see the bones of the medial wall, we can see that there are two major bones. They are the perpendicular plate of the ethmoid bone. This perpendicular plate forms the anterior superior part of the nasal septum, and the second bone is the vomer. The vomer forms the posterior inferior part of the nasal septum. Apart from this, there are also some other bones. They are known as the accessory bones. In the above and in front, the nasal spine of the frontal bone, okay, and in the above and behind, there is the sphenoidal crest of the rostrum, and in the below part, there is the palatine process of the maxilla. Okay, now let's consider the cartilaginous part. We have to know the anterior-inferior part of the nasal septum. This part is actually made of cartilage. So the major cartilages, we can divide it into the septal cartilage. Okay, the septal cartilage forms the anterior major part of the septum, and the other cartilage are the septal process of the lower nasal cartilage. Now, apart from these two cartilage, there is also another cartilage, that is vomeronasal cartilage. It sometimes intervenes between the vomer and the septal cartilage. Now, let us study the medial wall or nasal septum's artery supply. The artery supply of the nasal septum can be divided into different parts. The anterior superior part is supplied by the anterior ethmoidal branch of the ophthalmic artery. The posterior inferior part is supplied by the sphenopalatine and greater palatine branch of the maxillary artery. The movable part of the septum is supplied by the septum ramus of the superior labial branch of the facial artery. Okay. Now, if we see the venous drainage, we can see that the anterior superior part is drained into superior ophthalmic vein, and the posterior inferior part is drained into the pterygoid venous plexus. The movable part of the septum is drained into the internal jugular vein through the facial vein, and the upper part of the septum is drained into the inferior cerebral vein. If we see the lymphatic drainage, then we can see that the lymph from the anterior part, it drains into the submandibular lymph node. Lymphatics from the intermediate and posterior parts drain into the retropharyngeal lymph node. Now let's see the nerve supply of the medial wall. The nerve supply of the medial wall can be divided into the olfactory zone and the remaining zones. The olfactory zone is supplied by the olfactory nerve, and in the remaining zone we can say the anterior superior part is supplied by the nasociliary nerve. The intermediate part is supplied on the maxillary nerve, and the posterior part is supplied by the short sphenopalatine nerve, the nerve of the pterygoid canal, and the nasal branches of the greater palatine nerve. The anterior inferior part is supplied by the anterior superior alveolar nerve, and the movable part is supplied by the external nasal nerve. Now let's study the lateral wall of the nose. The lateral wall of the nose is irregular owing to the presence of three self-like bony projections. These self-like bony projections are called concha. The concas are superior concha, middle concha, and the inferior concha. The formation of the lateral bone is as following. The bony part is formed from before backwards by the nasal bone, the frontal process of the maxillary bone, the lacrimal bone, the labyrinth of the ethmoid with the superior and middle concha, the inferior nasal concha, the perpendicular plate of the palatine bone, and the medial pterygoid bone. The cartilaginous part is formed by the upper nasal cartilage, lower nasal cartilage, and also by 3 and 4 small alar cartilage. The cuticular part is formed by the fibrofatty tissue which covers the skin. Now let's study the artery supply of the lateral wall. The anterior superior quadrant is supplied by the anterior ethmoidal artery. The anterior inferior quadrant is supplied by the alar branch of the facial artery and the terminal branch of the greater palatine arteries. The posterior superior quadrant is supplied by the sphenopalatine branch of the maxillary artery, and the posterior inferior quadrant is supplied by the branches of the greater palatine artery. If we see the venous drainage, we can see that the venous blood from the lateral wall drains into the facial vein in the front, and in the behind it drains into the retropharyngeal vein and the pterygoid venous plexus. In the above, the venous blood drains into the inferior cerebral veins. If you want to see the nerve supply, we can see that the lateral of the nose is supplied by the olfactory nerves. Okay, this is the sense of the smell. Now if we see the general nerve supply of the rest of the lateral wall, we can see that the anterior superior quadrant is supplied by the anterior ethmoidal nerve. Then the anterior inferior quadrant is supplied by the anterior superior alveolar nerve. The posterior superior quadrant is supplied by the posterior lateral nasal branch of the pterygopalatine ganglion, and the posterior inferior quadrant is supplied by the anterior palatine branch of the pterygopalatine ganglion. The secretomotor nerve supply is the superior salivatory nucleus of the facial nerve. Now, if we want to see the lining epithelium of the lateral wall of the nose, the lining epithelium can be divided into three parts. They are the vestibule, respiratory, and the olfactory parts. The vestibule is lined by the skin. The respiratory epithelium is lined by the ciliated pseudostratified columnar epithelium, and the olfactory region is lined by the bipolar olfactory cells and tall columnar supporting cells and basal cells. Now let's study the meatus of the nose. The meatus of the nose are passages beneath the overhanging concha. Each meatus communicates freely with the nasal cavity. Now there are some structures, students, that open in the meatus of the nose, and you must know these structures. In the inferior meatus, opening of the nasolacrimal duct occurs. In the middle meatus, the opening of the frontal air sinus, the maxillary air sinus, and the middle ethmoidal air sinus occurs. In the superior meatus, the opening of the posterior ethmoidal air sinus occurs. Now let's study about the paranasal air sinus. The paranasal air sinus are actually air-filled spaces. They are present within some body areas around the nasal cavity. All of the paranasal air sinus actually opens into the nasal cavity through the lateral wall. The paranasal air sinuses are the frontal air sinus, the maxillary air sinus, the ethmoidal air sinus, and the sphenoidal air sinus. The function of these air sinuses are to make the skull lighter and resonance of the voice. The lining epithelium of the air sinus are pseudostratified ciliated columnar epithelium. Now let's study about the frontal sinus. The frontal sinus are two in number. Okay, their average measurement is vertically 3 cm, transversely 2.5 cm, and anterior posteriorly 1.8 cm. The frontal air sinus actually opens into the middle meatus of the nose. The blood supply of the frontal sinus is from the supraorbital vessels. Then the lymphatic drainage occurs into the submandibular nodes. The nerve supply occurs from the supraorbital nerve. Now let's come to the maxillary sinus. Maxillary sinus, it is actually the largest paranasal air sinus and very important. It is contained within the body of the maxilla. The measurements are the vertically 3.5 cm, transversely 2.5 cm, and anterior-posteriorly 3.25 cm. The maxillary air sinus, this actually opens into the middle meatus. The blood supply occurs from the facial, infraorbital, and greater palatine arteries. Lymphatic drainage occurs into the submandibular node, and nerve supply occurs from the anterior, middle, and posterior superior alveolar nerve. The ethmoidal air sinus, if we see that the ethmoidal air sinus are actually situated between the medial wall of the bony orbit and lateral wall of the nose. In the anterior sinuses, there are 3 to 7 in numbers, and they open into the middle meatus. The middle sinus, it is 1 to 3 in number, and it is formed by the bulla ethmoides, and it drains into the middle meatus. The posterior sinus is 1 to 11 in number, and it opens mostly into the superior meatus of the nose. If we see the blood supply, that is from the anterior and posterior ethmoidal branch of the ophthalmic artery. The lymph drainage occurs from the anterior and middle groups of the sinus, and it drains into the submandibular lymph node. Now, if we see the sphenoidal air sinus, we can see that they are actually lying within the body of the sphenoid bone, and they are 2 in number. If we know the measurements, the vertical measurement is 2 cm, transverse measurement is 1.5 cm, and the anterior-posterior measurement is 2 cm. If you see that the sphenoidal air sinus actually opens into the sphenoidal recess of the sphenoethmoidal recess and then into the superior meatus of the nose. The blood supply occurring from the posterior ethmoidal vessels. The lymphatic drainage occurs from the retropharyngeal node, and nerve supply occurs from the posterior ethmoidal nerve and orbital branch of the pterygopalatine ganglion. Thank you, students. So that was the topic lecture on nose and paranasal air sinus. I hope you'll have a great day, and thank you.